I looked at the circumstances and said, if you want to do research in Canada, medicine's a good way to do it. So I didn't go into medicine actually for the medicine. I went into medicine because I wanted to do research. And then, of course, once you get into medicine, clinical medicine is an awesome thing to do, right? It's always really interesting and you can make a difference for people. And so, it's what I love doing.
The contributions of Dr. McGeer is immense. She's a very distinguished clinician scientist. There are very few of them. She was involved in the first SARS epidemic in Canada. She's credited actually for containing the epidemic. Her personal efforts and her work and her advice saved many lives. She's been involved on behalf of Canada with international organizations like the World Health Organization.
She's a scientist through and through. She is somebody who really approaches things with an open mind. She's always open to hearing other people's opinions. She is very non-hierarchical, which is actually one of my favorite things about her. I think she's been a part of every pretty important outbreak in the past 20, 30 years. And on top of that, she does a lot of work in the infectious disease that maybe you don't see in the media as much. Things like influenza, group A strep, which can cause flesh-eating disease. Her research group has done an outstanding job of characterizing the epidemiology of those infections. That's been really important in helping us understand how to prevent and treat those infections both locally, and also that information has been relevant internationally as well.
She has taken conditions that we didn't even know were necessarily an infectious disease. She led research, again, very high-profile research that led to the identification of the bacteria that cause Whipple's disease and led directly to treatments for this not uncommon disease.
She has a really clear understanding of what's happening at the front lines, really from the ground up. Her goal is to enable things not just for other individuals, but for the greater public good. And I think it's that level of dedication to service and public service that really drives the way that she works. It's highly collaborative, is very generous, and she's an excellent communicator.
During COVID, she had quadruple duties, I would say. She did research, she worked as a physician, she worked as a scientist, she worked as an advisor, both to the federal government and to the provincial governments. She also spoke publicly, so she engaged with the public. There are just so few people who can do all of these things and do them so well at the same time.
You need to start with yourself. You really want to be doing what you love doing and what you're good at. And then you need to be able to recognize that the people who are working with you need to be doing that as well.
Allison was the one who said, okay, let's roll up our sleeves and get this done. She was always the first to raise her hand and say, we've got to do this. Tons of ideas, but also an incredible listener. And she's a great affirmer of people. She's the one likely to come and tap you on the shoulder and say, would you like to be a part of this? And then when you're a part of it, you felt like you were actually involved. And she's somebody who is very demurring in terms of her own accomplishments, even though she would be the one carrying a big chunk of the load. She is a giant, not only in that she herself is one of the most accomplished scientists that Canada has ever produced. If you look at her publication record, her impact factor, the work she's done with SARS, infection control, influenza. She's done everything. But I would say the real impact of her legacy is the imprint she's left on the lives of so many people. She always thinks about, how can I make this better? Not just the public, but the professionals that she has helped develop for Canada. Canada holds her a great debt of gratitude.
Revered mentor and guiding force in Canadian and international public health and infectious disease. Canadian Medical Hall of Fame laureate, Dr. Allison McGeer.